Good morning, everyone. Today, I want to help you figure out what type of provider you need. Say, for instance, you are needing medication. For medication, you can either go to your primary care physician, which is just your regular doctor, or you can go to a psychiatrist who is well versed in psychotropic medications. That means medications that deal with depression, anxiety, bipolar, all those sorts of things. If you're wanting counseling, you have several choices. You can go to an LPC, which is what I am, which means a licensed professional counselor. You could also go to a PhD psychologist. Some of them do therapy, but they also do psychological testing. For counseling, you may also go to an LMSW, who is also a clinician, someone who can do counseling, even though their background is in social work. But let me go back to the PhD psychology to tell you their other branch as well. Say, for instance, you need or you think you want to test your child for ADHD. There are tests that psychologists will do. If you feel like your child has a learning disability or learning disorder, you can go to a psychologist and maybe get psychological testing for those things. But those are the differences between some of the providers in the psychological world. But do your research, figure out what you really need. If you are currently suicidal, you need to go to the nearest emergency room so that they can make sure that you're safe. And we'll talk about what you need after that. But for those of you who are just generally looking for a provider, do some research. Again, if you want medication or need medication, that would be a primary care physician or a psychiatrist. If you want counseling, that will be an LPC, an LMSW, or an LMFT, which is a marriage and family counselor. Also, if you need testing, you may go to a PhD psychologist to have psychological testing done. Okay? I hope that helps you guys. Do your research and remember, be proactive with your mental health. Take care and God bless.